Hello everyone. The given images are too old. The scans had been done 20 years back, but they're still enough for the diagnosis. So we'll go to the quiz. This is about a 2-month old boy baby with his mother giving the history of intensive crying of the baby while feeding and also during defecation, which is progressive now. You can go through the magnified X-ray, its topo, ultrasound and axial CT images of the abdomen. You can go through the images, what are all the findings in each, and also with the given images you can go through the differential diagnosis, and please think about the probable diagnosis. If you want more time, please pause the video and assess properly. Are you ready? Let's go. You can see the X-ray and CT topogram. There is a large mass in the left side of abdomen that causes displacement of the stomach and bowel loops to the right side. You might see the calcific and ossific parts which are not very clear in this image. We can go to the ultrasound abdomen images. There's a large mass with calcific and ossific parts. You can see long bone limb like soft tissue pattern, all the 4 images, and they are mimicking like fetal limb bones as seen during antenatal scan. Now we'll go to the CT abdomen, and they are very typical bony parts mimicking axial parts of the spine, and you can see multiple fatty components, and there is well formed septation as in fetal brain, and this mass lesion is touching and displacing the left kidney. Whether this is a renal mass, so it's very less likely because it's out of the window. The differential diagnosis, very rare diagnosis of fetus in feto because of the presence of ossific pattern and spinal pattern. And the second one is teratoma, especially like fetoform teratoma type. The third one is very important, calcified meconium pseudocyst sometimes can mimic this, which is almost intraperitoneal. Neuroblastoma, which is very common, but you might have 90% of them will have calcification. And Wim's tumor because of the presence of kidney just close to it, which has 10 to 15% of the calcification, but not like this. Mesoblastic nephroma is almost against it because there is no calcification usually. So the final diagnosis is fetus in feto. So usually fetus in feto, the location is most common one is in retroperitoneal parts of the abdomen is very common. Then intraperitoneal, that can occur anywhere in the abdomen, but retroperitoneal is more common than the intraperitoneal compartment, but that has been reported, both of them have been reported. And less common ones like those in the mediastinum or pelvis or cranial cavity or in the scrotum also have been reported. So usually when you have vertebral column, which is the most common one, and if you have got vertebral parts in the mass lesion, it's most commonly it's in fetus in feto. And when both vertebral column and limb parts are there, it's almost pathognomonic to say that this is fetus in feto. But sometimes you might have CNS, central nervous system parts, gastrointestinal tract, vasculature, and genitourinary tract might be there, especially genitourinary tract in the lower abdomen and pelvis. We'll go to the difference. The main important one is teratoma. Teratoma is much more common than fetus in feto. The anatomical parts, when it has the fetus in feto has recognizable parts like spine and limbs as already mentioned, whereas the teratoma doesn't have a clear-cut recognizable anatomical parts without any organization. You might have a tooth parts or you might have bony parts, but never like a organized pattern. Second one is the growth rate. Growth rate is in the fetus in feto, it has a similar or less than affected fetus baby. So the fetus in feto means grows with the baby or the fetus, whereas in teratoma it might have the similar pattern, or it might be faster by depending on the benign or intermediate or malignant pattern. And again, malignant degeneration, this fetus in feto is not a tumor at all, period. But when in a teratoma, it's a benign tumor initially, and that might go for malignant degeneration. And the incidence is very rare in fetus in feto. They say 1 in 5 lakhs, whereas teratoma is very common entity which has been diagnosed antenatally too. The affected area in fetus in feto, 75% affects the abdomen more commonly retroperitoneally, and sometimes intraperitoneal compartment can also be there, whereas the affected parts in teratoma, anywhere it can occur, but more common in sacrococcygeal region. So that, and please note that both are common in male genotypes, and some authors describe both of them are in the monozygotic twins, and they might initially from the monozygotic twin that can go for conjoining, and it might go for that can be symmetric or asymmetric, and it becomes too much asymmetricity, it can go for parasitic twinning, and then it might go for fetus in feto, and lastly the teratoma, the tumor pattern. So fetoform teratomatous mass has also been reported, and also the coexistent fetus in fetu and a teratoma have been reported in the same fetus. So that fetus or baby has been reported. Finally, it has to be mentioned that teratomas are commonly encountered antenatally, and rarely fetus in fetu is being reported antenatally, now more commonly in this decade. Thank you very much for patient hearing. Bye bye.